that's an area that I've worked on for several years now, which is like it really tries to evaluate cost effectiveness of not just AML-based therapies, but it speaks to a bigger issue in the healthcare system in general. And I think what's important to keep in mind is that cost effectiveness is not considered at all in the drug approval in the United States. And I think whatever those results in terms of cost effectiveness yield, I think the clinical data are separate from that. And I think we've really made great strides. We've improved patient outcomes. We've developed better therapies, different side effect profiles, and our patients live longer. And that's always the most important priority. However, I think it's also important to just acknowledge that the resources in the healthcare setting are finite, and it's for those targeted therapies that we talked about, like the average wholesale price for a month's supply is frequently more than $30,000 a month. So that puts quite a strain on the healthcare system. And it's not only drug prices; it's also the entire cost of healthcare delivery are substantial, and if anything, they continue to increase. So I think we just want to provide some data to help stakeholders in the healthcare system make decisions. And I think there's some legislative initiatives here trying to curb drug price increases in the healthcare system. And I think ultimately this will be a collaborative effort between physicians, the pharmaceutical industry, healthcare payers, the government, patients, because I think ultimately financial toxicity is real, also for our patients, and I think that's something where we can maybe provide some additional benchmarking, and I think this should not inform treatment decisions, but I think it can help the conversation as a society as a whole. And I think what's also important to keep in mind, because is who is conducting those cost effectiveness analysis, because there are always some modeling considerations. This is in the way the models are being constructed, what goes into the model, what data sources are in there, what are the funding sources. And I think that's something that's important to keep in mind. And I think this is just the reference article is a review article that we published in a journal of the National Comprehensive Cancer Network, and I think we'll just kind of summarizes some of our thoughts.